Hi, good afternoon, and welcome to this webinar on recent advances in treatment of autism, cerebral palsy, and other incurable neurological disorders. I'm Dr. Nandini Gokulchandran, and today I would be um walking you through what are the new options for treatment of neurological disorders. So, I would be talking in detail about regenerative medicine or stem cell therapy, which I'm sure you are inquisitive about, uh, the pros and cons, as well as what is the process, how does it apply to neurological conditions, and what other new treatments are in the offering, such as hyperbaric oxygen therapy and ozone therapy. So those who have already attended our series of webinars, I hope you find it interesting again. And those who are new, I hope I'm able to simplify this topic for all of you. So this presentation is more for information purpose, and this is not a consultation. So why are we here? We are here because we either have a child or an adult in our family with a condition such as cerebral palsy or with autism or intellectual disability, or we know somebody in the family or in our nearby area in friends, or we are a caretaker, or we are a doctor, or we are a therapist, or we are just inquisitive to know what is new, since so much new information is coming out about everything and anything. So what's new about neurological conditions? So basically we are here as someone who is interested and someone who is keen to know what new is there for uh, people suffering from neurological conditions. So what is the current paradigm for treatment? What are the options currently for those suffering from neurological conditions? Number one, there is no cure. Most of the neurological conditions do not have a cure or definitive treatment. There is no surgical intervention. Most of the time, it's only medications. There is no surgery that can repair the brain damage. There's only rehabilitation or therapy. Once the brain is damaged, so far it was thought that nothing can be done and only exercise and therapy can help you. There are no medicines to cure, but there are medicines to alleviate or reduce the symptom. So, what is new? What is new that we are going to talk about? We have in the center rehabilitation, which is the pillar stone of treatment of most of the neurological conditions. On one hand, we have new treatment, regenerative medicine or cell therapy, or what we commonly known as stem cell therapy. So we can refer to as cellular therapy, cell therapy, stem cell therapy, regenerative medicine. On the other hand, we have something known as integrative therapies, which integrates or which complements all rehab and cell therapy to improve the functioning and quality of life of patients with neurological conditions such as autism, cerebral palsy, and intellectual disability and muscular dystrophy. So now what is this we are seeing here? You must be wondering, I'm talking about brain and suddenly here is a fractured bone. So this is just to give you an example that we know commonly. This is something which is very common sense, and we all of us know that if we fracture our leg, we start doing activity immediately, we worsen the condition. So what do? We first fix the fracture either uh, by a surgery or by a cast put on the leg. First, the fracture needs to heal, it needs to fix, and then you do exercise to be able to strengthen the muscle so that you can walk again properly. So, if that is true for a bone fracture, why isn't that true for brain as well? So if there is a damage on the brain, we need to first correct or to some extent repair that damage. And that's what I'm going to talk to you all about. That it is possible to repair the brain damage. You can see here, this is a brain, and the blue area here indicates low functioning or damaged brain. This is a PET CT scan of the brain. And here you can see after the treatment that the blue area has become green, that is, it has become activated and it is functioning better than how it was before. So basically the brain is healing from inside, and now when you do rehabilitation, now when you do all the therapies, you see better results. So the old thinking was that the central nervous system, once damaged, is incapable of regeneration. So please understand, this is a old dogma. This is almost 20 years old dogma, and we are still carrying it forward, thinking that the same is true. However, the new thinking or the new concept or the new understanding after a lot of research is that regeneration is possible through a process of cellular replacement and repair. So the brain does continue to multiply. There are niches or cells in the brain which continue to multiply. We understand it just by the fact that we do create new memories. Every day when we are living a new life, we create new memories. And how is that created? It is created by the cells multiplying in our brain in an area known as hippocampus and the connections which are formed. So those people who start forgetting what is happening today, like what have I eaten today or what have I done today, that's where the brain multiplication, the cells in the brain have stopped multiplying and creating new memories. So because we know now that new memories are created by multiplication of the hippocampal neurons, we know that cells do multiply lifelong in the brain, and this multiplication can be assisted by cellular therapy. So cell therapy or cellular therapy is an idea whose time has come. It is not science fiction. It is not something that you see in Star Trek or Star Wars movies. This is something very much here available and being done in India for more than 10-12 years now. So cell therapy is a concept, is a process where we bring hope from hopelessness. We help children who are on a wheelchair to stand and walk, children who are unable to speak to be able to speak, children who are unable to go to school to be able to go to school. So what is the concept? The concept is that you have a stem and you have a small sapling, and what you are doing is watering it and helping the sapling grow into leaves, flowers, and fruits. So stem cells are special cells in our body. They are like seeds. When we put the seed in the soil and water it well, then you get a stem, and the stem gives rise to branches. And as the stem gives rise to branches, further as the tree grows, leaves, flowers, and fruits can be born on this particular tree. Similarly, there are special cells in our body which multiply, which have the capacity to multiply, and depending on where they are put, if you put them in the liver, they can stimulate liver cells or they can become liver-like cells. If you put them in the heart, they can help heart repair. If you put them in the knee joint, they can help the cartilage repair. If you put them in the bone marrow or into the bloodstream, they can help the bone marrow become reconstituted. And at NeuroGen, we are using it to improve the brain and spine functioning and the muscle functioning. We are putting it into the spinal fluid to help the central nervous system repair itself. Cells can be taken from our own body and put in our own body. The concept is known as autologous transplantation. And when we take it from outside and put it into a patient's body, it is known as allogenic transplantation. So these are the modes of transplantation. So what exactly are stem cells? Stem cells are special cells which have the capability to repair, replace, and regenerate. So how do these cells work? First of all, they multiply. One cell becomes many cells into thousands of cells. So not all cells in our body are able to multiply and become cells of their own or clone themselves, but stem cells are those special cells. Then these cells, when stimulated, can become muscle cells, can become fat cells, can become blood cells, can become neuronal cells, can become heart cells, as I mentioned earlier. So this is an example of this here. The bright round cell that you are seeing is a stem cell, and a group of stem cells, when they were cultured in the laboratory, they gave out these axon-like tendrils or the connections which talk to each other. So this cell has now become like a neuronal cell or a nerve cell talking with each other. So this is possible, which is seen in the laboratory, and exactly happens what happens in the brain as well. These release chemicals, positive chemicals, which stimulate the repair of the brain or whichever organ that you're putting these cells in. I'm going to refer more to the brain because that's what I'm going to talk about. And improves the blood supply by improving oxygenation of the brain and helping healing and repair. So earlier, if you go back to the 1990s, we had so many different, technology was booming, and we had a calculator to calculate, we had a computer to do a complicated work, we had a torch for the light, we had the black phone to, or a landline, we had a watch, and we had television, and we had camera, and we had still camera, we had books, and so we had all these different technological gadgets, each one doing their own activity. But now in the 2020s, what we have is one iPhone or a one Android phone which can do the work of all of these. So that's where stem cell is has a simile, that now stem cell is one process or one procedure or one tool which can do so many different actions that different medications will do. It immunomodulates, it promotes angiogenesis, formation of new blood vessels, it stops cell death, it prevents cells from dying, it stimulates cell migration so the cells can go to the site of damage to repair, and it also acts as an antioxidant. Many of our disease conditions are because of oxidative stress, and cell therapy acts as an antioxidant. So it's now the Android or the iPhone of current times. So, what are the different types of stem cells? Where do you actually get them? Can you go to a shop and buy these cells? Maybe in the future that is going to be possible, that we get off the shelf stem cells. In fact, people do ask us about plant stem cells. People ask us about cells which are there are these concoctions which are sold as stem cell products, which are derived from apple or from grapes. Those are plant biologics. Here we are talking about the animal biologics here. So these stem cells from the animal kingdom, from human body, they can come from embryos. So the first that you are seeing is the embryonic stem cell. All of us at one point of time were embryos when we were in our mother's womb, and when we were one cell stage, and we became two, then became four, and became a bunch of cells. And these bunch of cells then started to make different organs. So when this bunch of cells is taken out and cultured in the laboratory, when it is a 3 to 4 day embryo, it can form every different tissue of our body, and hence they are known as embryonic stem cells, because we take it out from the embryo and it can actually theoretically form the whole embryo or all the tissues in the embryo. However, it is mired in controversy because we are taking an embryo, and there are different concepts, or there are different thought processes in religions which believe that life starts at the time of conception, and we are killing an embryo in order to retrieve the embryonic stem cells, and thereby there are ethical issues surrounding it. Also, these cells have the possibility of forming bunches of cells known as teratomas, or we can also refer to them as tumors or benign tumors. So hence these cells or embryonic stem cells are currently not feasible to be used directly for medical treatments or for clinical transplantation. They can be used very well for research purposes. The second option that we have is the cord blood. The cord blood, now all of us know, it's a big branch, as well as it's a big commercial enterprise, that is storage of umbilical cord blood. When the child is born, the child and mother are connected by a cord, and the vein or the umbilical vein in the cord, from there we can take out a lot of cord blood, and that cord blood has a lot of stem cells of that particular child. Cord blood has been used for blood disorders and is much more established for hematopoietic disorders. There are some studies which are going on for autism and cerebral palsy. However, we must understand that cord blood is stored in a cryopreservant in order to keep the cell viable and alive. So the cord blood basically is stored in -190 degree centigrade in liquid nitrogen using a chemical known as dimethyl sulfoxide. Now, this chemical is a good cryopreservant, but when the cells have to be used for treatment, it has to be brought to room temperature and completely washed off this chemical has to be washed off. Even a little bit of chemical, if it remains, it can cause a very bad reaction in the body. And hence, for brain disorders, we are a bit hesitant to use cord blood. It can be used very well for blood disorders. So now what do we have in our hand? We do have our own body stem cells, as Stephen Hawking said. These are cells which are there in our bone marrow, in our teeth, in our fat tissue, and the most and oldest studied is the bone marrow. The bone marrow is a place where blood is formed lifelong. You can see here, we know that blood is formed continuously till we die, and bone marrow is the place. So bone marrow can be used as a source of stem cells. There are no ethical issues. We are not killing an embryo. We don't need to store it. It is always there in our body. As long as our body is healthy and our hemoglobin is good, we should be fine. So bone marrow becomes a easier source, more feasible ethically as well as clinically to be used, and these are adult stem cells used from our own bodies and hence safe and effective. So adult stem cell becomes a more attractive source of stem cell for clinical use. What we also have is something known as induced pluripotent stem cells or designer stem cells, which are being researched and in 2012 got the Nobel Prize, which I will be talking about shortly. So, what is this? What am I going to talk here about? So, here on one hand, you have alcoholic beverage, and on the other hand, what you have is a homemade orange juice, right? So, both of them are beverages. Are they same? Can we pull them in the same basket? So, when we put together alcohol and homemade oranges together, what we are seeing is that both are toxic and they have long-term problems or side effects. Right? Similarly, when we put all the types of stem cells together and put a generalized note there saying that stem cells are banned or stem cells have side effects or tumor formation, that's what we are doing. So embryonic stem cells are akin to alcohol, while adult stem cells taken from our own body are like homemade orange juice made by a mother with a lot of love, which I'm sure you know is nutritious and doesn't really affect adversely any person or a child. So why do we choose to work with adult stem cells? Exactly for this reason, that it is safe, it is non-tumorogenic, there are no rejection issues, it is easily obtainable from the same patient using a very thin needle, no ethical issues, we are not killing an embryo. Cells taken from bone marrow are, after processing, injected intrathecally into the spinal fluid when we are talking about brain or spine disorders. And why are we injecting into the spinal fluid? Now let us consider what are the ways that we can actually put the cells back into our body after they are purified. One is intravenous. We can put it into the IV, and that is the most simplest. And I think people are, much more comfortable with that concept of putting intravenously. But just think, where all does it travel? We put the cells intravenously. Where does it go? It goes through the vein, and then it will go through the bigger vein. It goes through the heart. It goes to one part of the lungs. It gets from the lungs again. It is pushed back. It is purified, and then it goes to the all other organs, and finally when it reaches the brain, we don't know how many cells are actually remaining and how many will actually reach the brain. So it becomes a systemic flow. Many of the cells get trapped in the lungs and very few actually reach the targeted area. So though it is safe, the efficiency of intravenous administration is very low. On the other hand, we can inject directly into the brain by a process known as stereotactic injection. Though it is a direct injection and possibly more efficacious, however, you will see that it is more risky. That when you are injecting directly into the brain, your cells will pass, your needle will pass through normal tissue as well, and it becomes more damage can occur, or you can lose your life as well. So either we have intravenous or we have stereotactic. So what we have found is something in the middle. We have found something which is neither as invasive as a stereotactic nor as low efficacious as intravenous. So what have we found is intrathecal. So we inject the cell into the spinal fluid. It is minimally invasive. It requires only one needle into the spinal fluid, not into the brain. So that way we are not going directly into the brain. It has no major side effects. The cells will go directly either to the spine or into the brain. No other place, doesn't get filtered into the lungs or any other tissue in the body. And also, we are not cutting or we are not going into the brain, so no risk or damage. So very simple process, but efficacy is more because targeted into the nervous system. So using the process of cellular therapy or stem cell is one of the tools for regenerative medicine, where you can see this is a brain, the blue areas is a damaged brain, and the cells go and help repair this damage and improve the functioning of the brain. So what is the scientific basis for the cell therapy? Is it something new? Is it something which has come yesterday, or is it something which has been researched for a long time? So in the history of Nobel Prize, as you all know, Nobel Prizes is like the Oscar award in education, research, and medicine. So in the field of stem cell research, the first Nobel Prize was awarded in 1990 to the demonstration of stem cells in the bone marrow, which we use. So right in 1990, so the research would have started at least 20 or 30 years before that. So a lot of work has happened since then. In 2007, the second Nobel Prize was awarded to Sir Martin Evans for the isolation of embryonic stem cell, and recently in 2012 for the concept of induced pluripotent stem cell, two scientists have been awarded. So the field of stem cell is quite illustrious, and there's a lot of work which is gone and still happening. What is the scientific basis of the work that we do at NeuroGen at our institute? So we everything that we do has background research. We research everything that is being done here. Everything is published, and we have 101 plus scientific articles on the various disorders that we treat, the understanding of the disease, as well as the role of stem cells and newer treatments in various conditions like autism, cerebral palsy, muscular dystrophy, spinal cord injury, brain stroke, and intellectual disability, and other conditions. In autism, we have also contributed to book chapters on recent advances in various neurological conditions like autism and cerebral palsy, with our contribution on stem cell therapy in these disorders, which gives credibility to the work that we are doing. Cerebral palsy also, a book on physical disabilities, has a chapter on stem cell therapy in pediatric neurological disabilities, muscular dystrophy. Uh, Even the government of India at the highest level is supportive of stem cells. Our Prime Minister, when he first came into power, actually went and visited the Nobel laureate Shinya Yamanaka in Japan, and a lab was set to work on stem cells for various blood disorders. This is our director and neurosurgeon, Dr. Alok Sharma, presenting the book that we have written on stem cell therapy neurological disorder to the Prime Minister. The Prime Minister has also written a preface for one of our books that we have written on muscular dystrophy and its translation. And he's also spoken on the role of use of stem cells and the importance of research of stem cells in the parliament.
जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट का वहां को मैं इसलिए किया गया, उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलुरु के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So he's talking about the use of stem cells for sickle cell anemia or a blood disorder. So how is this treatment done? There are different ways of doing, but I'm going to talk about how the treatment is done for neurological conditions at NeuroGen. So at NeuroGen, the process is very simple. Needle is put in the hip bone in the front. So you don't need to really lie on your stomach. A patient is lying very comfortably on the back, is sedated. Children are sedated. In adults, it's on in local anesthesia. A very small, very thin needle, as thin as a nib of a pen, goes into the hip bone, and the bone is a hollow bone, and which contains the marrow. So the marrow is aspirated out. It's like thick blood, which is then processed in the laboratory. We do not need the red cells which deposit down. We need the white cells which come up as a buffy coat that is separated out. The stem cells are then injected into the spinal fluid. So it's a very simple process for the patient. It is 10 minutes of aspiration and 10 minutes of injection, while in between is the process of the cell separation. So bone marrow, now it is being processed in the laboratory, checked, and then you can see the viability is checked and then injected into the spinal fluid using a very thin needle in the lower back. So no cut, bone marrow aspirated. The processing, you can see now here is a bunch of cells, millions of the mononuclear cells that we are going to inject into the spinal fluid. Test checked for viability, how many cells, what is the percentage of viability, and then injected. So now let's come to the point and look at what is the result in various disorders that we treat. Here is on autism. So what is autism? Autism is, as we know, is a neurodevelopmental disorder. Was first described by Austrian, known as Dr. Kanner, and is detected usually between 1.5 to 3 years. Is a spectrum. There can be children with mild problem, moderate, or severe problem. Generally occurs or is seen more in boys than in girls. The reason is not really clear. The main three problems: poor socialization, impaired communication, and restrictive or repetitive behavior. So all of these are the main issues, but then you see a lot of hyperactivity, and then you see children with temper tantrums, unable to speak. All of these are hidden issues. Now, why is it that we need to really address this condition? Because the statistics is alarming. The prevalence is on the rise, and it is rising exponentially. So you can see that in 2004, the prevalence was 1 in 166, while 2018 it is 1 in 59. The recent 2020 data suggests 1 in 40. So it is a alarming rise in the prevalence of autism. Almost 70 million people are on the spectrum, 1% of the world's population. So it is not a small number, it is a huge number. So let us understand what is the fundamental problem. Do we really know why it happens? There could be genetic factors and there could be environmental factors. And genetic factors are still being understood, but not all the genetic gene mutations can conclusively cause autism, but could be associated with autism. We have seen twins or sisters or siblings in a family having autism, but definitely we feel that it gets triggered by environmental factors. We can sort of control and have some say in the environmental factors. We may not really have a lot of say on the genetic part of it. So let us look at the environmental factors. Prenatal and antenatal causes: when the child is in the mother's womb or immediately after the child comes out, there could be a problem. Intestinal dysfunction is one of the problem or symptoms in autism, which aggravates the symptoms further because of indigestion or constipation, improper nutrition. The child's condition may worsen. Exposure to toxic chemicals in the environment, the pollution, the adulteration could cause brain functioning or brain development issues when the child is in the mother's womb. Use of mobile phones, though it is not a very conclusive, there are not many conclusive studies, but uh, there is an indication that possible electromagnetic radiation exposure could affect possibly more when the child is in the mother's womb and the mother uses too much of telephone. Screen time, too much screen time also tends to aggravate a child's problem and causes a regression in children. So prenatal or antenatal, majorly anemia or undernutrition in the mother, maternal infections such as torch, which are generally not picked up very early, maternal diabetes, depression, stress in the mother, PCOD in the mother, smoking by the mother. If the father's age is more, the risk of a child developing neurodevelopmental condition is higher. uh, any abnormality in the GI tract in the child, as sometimes also in the mother, could cause increased problems. Exposure to electromagnetic fields, as I said, it could alter the brain activity and cause increased permeability of the brain barrier to toxic chemicals. And finally, the toxins, lead, too much of lead in the blood may cause brain damage, causing intellectual disability and other neurodevelopmental conditions. Mercury poisoning, aluminum poisoning. Now, vaccines in ESD is a controversial topic, and though in the year 1998 it was proposed by Wakefield and group that MMR could cause autism, after that there were about 25 articles which refuted that this particular claim, and it has been found to be not enough evidence that autism is caused by MMR vaccine. However, still people do continue to believe that. Um, as a professional, as a doctor, we do not really support that support that thought process, because infectious disease, and we also now seeing infectious disease like COVID could cause much more damage than what autism can cause. So we have to take the worst of the two evil. What is more life threatening? We can always improve quality of life in an individual with autism, but a child, if with measles gets measles encephalitis because has not had a measles vaccine, that would be really really sad. Now, what exactly happens in autism on the brain of a child with autism is something which was not really looked at in depth, but recently in 2019-20, we published a paper in the World Journal of Nuclear Medicine, where using a PET CT scan as a prognostication tool, or as a tool to understand brain functioning or brain metabolism, we found that there are certain areas of the brain which are functioning less. You can see these blue areas. These indicate low functioning brain. The blue area is hippocampus, amygdala, and thalamus, and cerebellum. So these are the areas which are functioning less and lead to various symptoms of autism. This is the original article published by NeuroGen. Now, the gist of this article is that this is a graph. The blue line that you are seeing is the brain development of a neurotypical child. So you can see that the brain uh, mm, functioning or brain metabolism increases up till the age of 10 years. You can see it growing fast. And then after 10 years, it does grow up till the age of 15, but slightly slowly. Okay, so this is a neurotypical brain. What you can see orange here, surprisingly, is that this is the graph of a child with autism or children with autism. So you can see initially the child with autism brain is much more higher functioning. The cortical metabolism is higher or in early age. Then it goes down, and at some point it keeps going down, and the gap between a neurotypical and autistic brain keeps on increasing. That's why the concept of early intervention. If we do intervention early, if we do the treatment early, you can push this graph up much faster. You have lesser gap to fill. So that's why doing treatment early is important. And we have also shown in our publications on autism that when we treat the child early, we get the best results. So what are the treatment options that we have? We have a whole lot of treatment options, but all of them need to work in sync together to rehabilitation, biomedical, the neurofeedback, the HBOT, and stem cell therapy together would give the best results. So it's a multidisciplinary management. Neurorehabilitation, many parents know what it is, basically doing ABA or cognitive therapy, occupational therapy, sensory integration therapy, speech and language therapy, physiotherapy also has a good role, and aquatic therapy, art-based therapy, chelation, removal of heavy metals is something which is being done by various chemical methods, giving supplements, because the thought is that maybe the supplements given in the food is not being absorbed properly. diet and nutrition, GFCF diet, but the main principle is avoid sugar, avoid junk food, avoid additives, uh, try to give more of probiotics and more uh, organic food as well as a lot of vegetables. So we're doing all of this, but is it enough? So somewhere we find that the problem in the brain is not corrected. We are doing a lot of helping the gut, helping the nutrition, helping doing therapy, training, but somewhere there is a gap. Somewhere you see a block that, in spite of all the efforts that you're taking, your the child is not improving as faster, and that's where the problem that we do all accept that the problem is in the brain, though may not always be identified. So stem cell therapy basically addresses that part of the brain where the problem exists and correct it. And we will see how it is corrected. And the broad results we find is about 90% of the patients that we treat, or children or individuals that we treat, do improve to various degree. 25 to a mild extent, 29 to 30% to a moderate extent, about 33 to significant extent. And percentage of autism, various symptoms of autism that we see: hyperactivity reduce, understanding improve, comprehension, learning, grasping power, eye contact, ability to sit in one place, sitting tolerance improve. Then you can teach the child better, and then communication and socialization. So the first ever uh, scientific literature published on the use of stem cell in autism came from NeuroGen, came from India in 2013, where we showed about 32 children or individuals how they improved. We also studied the PET scan. You can see the blue areas here are before the treatment are much more darker, and you can see that blue becoming lesser and green increasing, indicating improvement in brain functioning. Again, you can see the blue area, you can see green, so the blue becoming green. So these are a few examples. This takes about 6 months to see the changes. Definitely correcting the brain information or recorrecting the information is takes time. Also takes good therapy and rehabilitation, and sustenance of improvement over a period of 1.5 2 years is what we are seeing here. June after 6 months, and then again after 6 months. Okay. Now, cell transplant, the next study that we published in 2020 recently talks about 254 individuals, 2 years to 34 years, followed up with minimum of 7.5 months, where we found that symptomatic improvement in most of the symptoms seen, but most importantly, age is of important. We find that earlier we treat better the results. So you can see here less than 5 years, 0 to 5 years, 97 to 98% is the success rate. 5 to 10 years, 94 to 95%. 10 to 15 years, 90 to 94%, and 15 and above, about the same. So as the age increases, the possibility of success dips down. So that's why earlier you treat, better the results. Closer you treat the child to the diagnosis, better the results. And both in males and females, the result is the same. The first study came from India, second from China, third from Italy, fourth, fifth, and sixth from US, and the seventh recently from India again. So these are all our studies on autism. These are our scientific literature, our publications, and this treatment can be done in combination with other treatments as well. Chelation, we may have to stop for a couple of months because the cells may the TRS agent or even the chelating agent may cause damage to the cells, but otherwise other therapies we can do along with stem cell therapy. Let's look at a few examples of children with autism. This is an example of a 10-year-old boy from the US. Father is a doctor, mother is a nurse.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
You would flap like that. walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech or research and found out about NeuroGen. But the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He's so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the third grade, fourth month reading level to a seventh grade, first month reading level in 5 months.
So in 5 months, such drastic improvement in his academic skills. That's what this is showing. You can see that he is getting more AA in most of the subjects. He got one of the best GPAs, and he knows Spanish along with English. He can speak. He's like a regular teenager. He shifted from special class to a normal class. So that's amazing improvement even at the age of 10 years.
We went to different
So this is a
doctors,
story of a triplets from
different
Kenya.
hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. No child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he's sleeping. His children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autism is.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear, a bit of apprehension. Anxiety, of course, as a mother, but I knew the importance.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilets. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed. It takes a few minutes and he's asleep.
You see my son's cycle. We try to make them understand what it is to pep and include it. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you for what? parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
Every time I see this video, it really amazes me because I've seen these children when they came first. We had to actually clear up one full room, remove all the refrigerator and the microwave and whatever gadgets were there in the room, so that they could just run, and they used to spit, and they were really, really hyperactive. And seeing the way that each one of them is improving, one of them is almost, at mild and out of the autism spectrum, conversing, and thinking logically. The other child, second one, has also started speaking, vocalizing now. They're much more calmer and much more active. So that's something which I've seen, and I can really vouch for this. There are amazing improvements in this really hyperactive children. Now Shantanu from India came to us when he was not 15, when he was 11. Now he's 20 years old, and amazing improvement from what I had seen him the first time.
Child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me, and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on the feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief,
Shantanu has come a long,
but now
long
he
way
can
again,
easily fold
and
blankets.
he, in fact, his sensitivity, understanding
He helps me in
improved so
cutting
much
vegetable and in cooking too.
that he's able to supervise children with
Goes to the
hearing
market store for
disabilities.
purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, his emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
So Shantanu has come a long way as well. So many children that we have treated doing very well. This is a child from South Africa who came to us where he had a lot of problem with sensory issues, his joint as well as proprioception sensitivity, as well as gravitational insecurity, that is, climbing heights, and problem with sand, and even attention, sitting still, auditory problems. So all of this improved so much so that as sensory processing became better, he was responding better, eating improved, sitting tolerance and activity improved, hand to mouth functioning. So Tristan here has come a long way again, improved motor planning. This, so many parents tell that children don't want to climb and go up and do the ladder as well. This is another child from Kenya, very, very hyperactive till the age of 13. He came to us when he was 13 years old. He was practically homebound up till 13 because he was so hyperactive that parents could not send him to a special school. He has calmed down, his understanding has improved. He does go to a special school, who does very fine motor activity, does his stuff at home, or used to run away and roll on the ground, remove his clothes and run away. Victor has really calmed down now, and his understanding, his socialization, his ability to cycle, he's learned swimming. So many areas that he has progressed in. But we find that when children come to us younger, they are smaller, we can do so much more with them. So this is a 2-year-old.
Once upon a time, Peter Chad was walking down the street and then
So Zach came to us when he was 4 years old. He was practically non-verbal with maybe 1 or 2 word vocabulary. And this, as after 3 years, he's making his own stories. He's much ahead in reading and understanding as compared to his peers. So just imagine what we can do when a child comes to us at 3 years, 4 years, or 5 years.
berries. What color did it turn in his shoes?
Can you really,
Red.
accept that this child was diagnosed to have autism when he was and he came to us from South Africa when he was 4 years old? I find it amazing myself. So these are the kind of amazing results that we have seen over the last 10 years. But yes, earlier you treat better the results. You can just continue to listen to him all day long. I've heard this video so many times. Cerebral palsy. Now let's go to the other condition which is commonly seen, that is damage to the brain during when the child is in the mother's womb, or when the child is coming out, or immediately when the child comes out. So damage to the brain leading to various kind of problems. The damage could be during pregnancy, during delivery, or shortly after birth. As I said, it could be only one hand affectation, it could be one side affectation, only lower body affectation, or the whole body affectation. So can be tightness, or there can be movement problem, or there can be hypotonia. This is a PET scan. You can see the black area is completely damaged brain, dead tissue, but you can see the blue area around which can be salvaged. So this is the area that we would be working on. The stem cells would help to improve this blue area and not the black. What is dead, cannot be replaced, but what is blue here can be stimulated to function better. And as the functioning improves, then rehabilitation can help these cells to learn and network. Current therapies, we know there is surgery for opening up the spastic limbs, injection of Botox to soften the bones or to relax the bones, rehabilitation, medications for epilepsy and tightness. With stem cell treatment, we find about 90% of the children improving in various functions, such as oromotor. We find first understanding comprehension improve, then oromotor, tongue movement, lip movement, chewing, swallowing, and speech. Neck control. Neck control improves, then the child is able to sit better. When you're able to sit better, then trunk control improves. Trunk control improves, then standing and walking. So this is how the improvement will happen, and then the tone of the hands and legs will improve. This is a data of 262 children with improvement in various areas: upper limb movement, standing, sitting posture, walking or ambulation, overhead activities, trunk movement dissociations, they call it, that different parts can move in different ways, achievement of milestones, as well as reduction in involuntary movements. So improvement in various scores, that is clinical scores, which denote the severity, reduction in the severity. And the brain scans, a PET scan, here you can see the blue areas are damaged, the black completely dead. So the blue areas can be salvaged, can be stimulated to become more active. This is the study, and these are all our publications, a few examples. This is a child with what is known as chorioathetoid cerebral palsy. It came from Nigeria to us and stayed with us for a month. This is post-jaundice, that he had a brain damage, severe involuntary movements, no control on the body at all, not even able to sit or dead. He would topple down with stem cell. He He gained better control of his body, to be able to sit up by himself, to be able to use his hand, to maintain his balance. Cognition improved, and ability to do simulated activities like bathing improved. So this was we were able to achieve in 1 month. So if you're able to continue the rehab for a longer time, you can achieve so much more. This is again a child from Kenya who came to us 14 years of age, quadriplegic cerebral palsy, came on a wheelchair, and just see how much he's recovered. He was cognitively all right. He was studying in 8th grade at that time, and he's now cleared 10th and should be in like 11th or 12th at this point. So we worked on all his skills, upper motor, hand function, oromotor, eyes, standing, walking. You can see fine motor improve, his ability to do basic things at home where he doesn't need help anymore, which he needs. And you can see finally walking independently. So final goal of walking has been achieved. This is a child, severely dystonic severe spastic cerebral palsy, totally bedridden, severe brain damage, half of the brain not there, neck control affected. So from 2016 to now, we must have done at least 3 or 4 procedures for him, and slowly, steadily, you can see an improvement. But there was no control at all. Is able to hold neck, then sit, then worked on the standing and getting up, and then you can see that much more stable body, much more alert, much more looking ahead, and now ambulation or putting the leg ahead. So this is the improvement that has been seen over a period of 3 to 4 years in a child of 6 years who was totally bedridden. So it takes patience, especially in severe cerebral palsy. Takes patience, takes time, but you just need to persevere and keep at it. This is a child from Orissa, from Bhubaneswar. You can see here, child had neck control, but sitting balance was not there. He's an ataxic cerebral palsy. Balance very much affected. Speech, cognition also affected. He had so much of involuntary movements. You can see stability improved. The child is now cognitively so much better. He can study in school, goes to school. Speech is much more clear. Understanding has improved. Walking is very, very stable. Doing activities like climbing, and very, very talkative child now. So climbing stairs now, actually stopped wearing the earphone now. So stability so much now that he can do climbing uh, stairs, as well as do fine motor activity much better. Coordination is much better. Breathing is much better. And he's grown in front of our eyes, and he's become a big boy. And see, now started brushing on his own, eating on his own. So finally, that's what we want him to be: become independent, start wearing pants on his own. Identify animals. Cognitively, he has improved a lot. So we can just go on and on. Intellectual disability, where again the brain functioning is limited. You can see the blue areas here, and our results are about 84 to 85%. Understanding, cognition, memory improves, problem solving, understanding of relation and social interaction, social inhibition, where how should we talk, where, what should we, how we conduct ourselves. Toilet training has improved. This is one of the first International Pubmed Indexe paper on stem cell therapy in intellectual disability, again from NeuroGen. You can see the brain, you can see blue areas becoming green. You can see the cortical atrophy. You can see as if the brain is being eaten up by the mouse. So this is the brain before the treatment. You can see now green, extremely active brain. So these are a few examples, and these are our publications, scientific articles. Let's see of example. This is story of Pratibha, which I love to tell. Pratibha, her name is Pratibha, and I feel that Pratibha came out after the stem cell treatment. She is a professional sitar player now. You will see her sitar. Her cognition improved, her how to interact socially, how to speak, how to conduct herself, coordination, fine motor activity. She learned sitar after doing stem cell treatment. She was always a Bharatanatyam dancer, but her coordination, balance, rhythm sense all improved after the treatment. And cooking at home, yes, she participates in cooking contests. So this is Pratibha. So let's look at Down syndrome. Down syndrome is a chromosomal condition. Many people ask me, and I'm sure one of the questions would be about genetic disorder. So this is not only genetic; it is chromosomal. So even in chromosomal disorders like Down syndrome, brain functioning can be improved irrespective of the mutation that you see. In Down syndrome, you have trisomy 21, so 21 number chromosome instead of being 2 is 3. And here you can see improvement. This is a I'm sorry, this is the different features of Down syndrome, where the heart can be affected, the GI tract can be affected, the endocrine system can be affected, brain functioning can be affected. Though there is no cure, the treatment that is done at NeuroGen helps improve the brain functioning. You can see here the blue areas have become green. So the brain activity took about 6 months to 12 months to see this improvement. Blue area becoming green. This is a child of 12 years, Down syndrome, used to go to special school, was always being rehabilitated, but the improvements seen after the stem cell treatment have been amazing in terms of maturity, cognition, understanding, speech. Speech clarity has improved beautifully. Her understanding, ability to learn. Earlier, she could not learn, she could not concentrate. Now, she's interested, she learns, she participates. Her physical movements are much better. She had severe hypotonia. Now she is able to jump, she's able to climb, she's able to do fine motor activity much better. She's able to dance, which so requires a lot of coordination and balance. Motor planning, better motor planning and balance. Before the treatment, speech was not clear. You could hardly make out what she's saying. So much more clarity. So tongue movement, lip movement is much better. Fine motor activity, learning, hopping with one hand, writing. She now knows the weeks of the alphabet, weeks of the days of the week. So many examples. So I'm just giving one example for want of time. Muscular dystrophy. If somebody wants me to talk about muscular dystrophy, please raise your hand. Muscular dystrophy is a topic in itself. It's a very complicated condition where the muscles start shrinking, and there are different types of muscular dystrophy. Yes, I can see two people have raised, so I must talk about muscular dystrophy. So basically the muscle starts atrophying. It is basically a genetic condition where the muscle atrophy happens and the muscle gets replaced by fat. Now, it can happen at very early age, generally in congenital muscular dystrophy or Duchenne muscular dystrophy, or it can happen, or the manifestation or the problem can be start with visualizing after teenage or 15, 20 years. So the protein affected in the muscle can be different genes may be affected, but finally what happens is that muscle breaks and instead fat gets deposited. So if you see this MRI here, you can see the black or the gray here is the muscle, and at the age of 5 years, 9 years, you see more muscle and a little bit of white part, that is a fat. But as the age increases, you can see 8 years, 9 years, 10 years, the white part is more. The white is the fibrofatty tissue. The muscle has converted into fiber and fat, which doesn't have any strength, which doesn't have any resilience. It breaks even on a little bit of strain. So no power and breaking. That's what happens at the age of 16. You can see almost complete fibrofatty tissue. So what are we doing here? So what happens in these individuals and children is that as the muscle weakens, the walking stops, the deformities, you can see the deformities here. Deformities set in, hand and legs become deformed, the spine twists, and because of which breathing becomes affected, and the individual generally dies of respiratory distress or cardiac failure. So in this condition, apart from injecting into the spinal fluid, we also inject cells into specific muscles. You can see the marking here. These are motor points on the muscles where the nerve enters the muscle, or the nerve comes out of the muscle. These are special motor points, and that's where the cells are also injected. So rationale for using, though it is a genetic condition, we use the patient's own cells because we can help improve the muscle, we can improve the angiogenesis, that is formation of new blood vessels, improve, reduce the inflammation in the muscle. There is a ischemia, that is the blood supply to the muscle is reduced, that we can improve. So what can we do? We can help muscle repair, we can replenish the stem cell pool, because it has been seen, there is a study in Lancet which says that Duchenne muscular dystrophy is a stem cell disease. So there is a lack of stem cells in the muscles. We replenish the stem cell pool, we reduce the inflammation, we improve the blood supply. The stem cell reduces that cell death, reduce the fibrosis, conversion of the muscle into fiber, that is prevented, and thereby overall improving the signaling of the nerve and the muscle, so that synaptic junction can be improved. So all these ways we can improve the muscle functioning, prevent the muscle from deteriorating. So it is not a definitive cure for muscular dystrophy. However, we can stall or stop the muscle degeneration. We find that we are able to help children walk for a longer time, and the survival can also increase. So what are we actually doing in muscular dystrophy is this: with time the muscle weakness increases. If you see, this is just generally the slope or the graph of deterioration in an individual or children with muscular dystrophy. When we do the treatment at a particular point, we are able to stabilize the disease progression. And what we see is this: at this point, suppose we had not done the treatment, we would be here, and with the treatment we are able to stabilize, and this is the improvement. This is a hidden improvement below what we see. We may say that, oh no, treatment hasn't helped, the patient or the child is as he is. However, what we do not see is that if the treatment was not done, he would have been much below the graph. So this is the hidden improvement. These are all our publications. And let us see, this is a child from Western Europe who came to us. He was diagnosed to have muscular dystrophy at the age of 11 months. They picked it up really early. And child came to us. When he came to us, he was walking, but he had difficulty in motor functions. He had problem in stability. You can see he was difficulty walking in the physiotherapy. Now he can ride a bicycle, he can climb, and we expect that if we continue the therapy, the treatment at regular intervals, we can improve his survival, and especially we can delay the complications and improve the ambulation. Even the MRI that we do before the treatment and after shows that the disease has stabilized, and he's now able to, you can see, ride the cycle, which it was not possible earlier. Spinal cord injury. Anybody interested in spinal cord injury? Please raise your hand. Okay, already two. Okay. Okay. So spinal cord injury, there is a damage to the spinal cord either because of accidents or fall, or there can be infection. So at any point from the cervical to the lumbar, there can be a damage, and based on where the damage is, the neurodeficit will be. So if the person may not be able to raise his hand or sit properly or stand or walk, and will have could possibly have problem in sensations as well as bladder and bowel. So we find that in different levels of injury, we find different improvements. We generally find, like in cervical spine or in thoracolumbar spine, improvement in functioning may be. So what we see is motor function improvement. I always tell people think that if sensations don't improve, they will not be able to walk, and that is not so. Even with, for example, in muscular dystrophy, they do have sensation, but they don't have motor power. So still cannot walk. So in spinal cord injury, focus of the treatment with regeneration and rehabilitation is basically improvement in function. So if a patient is neck down paralyzed, the idea is to be able to make him sit and become wheelchair independent. Those who are waist down paralyzed, the idea is to make them stand and walk with support so that they are able to at least lead a semi-independent life. So to improve functioning and to improve quality of life, sensory improvement is seen gradually in a few patients with bladder bowel and improvement, but that is not the primary goal and that is not the primary achievement. So these are our publications in spinal cord injury, and let us see a few videos where I can describe to you how improvements happen. This is an individual who came to us who was waist down paralyzed and totally wheelchair bound. Sitting tolerance, sitting dynamic balance was affected after treatment. Immediately, the first thing that we see is center. Always the axial skeleton, the center part of our body improves. So balance improves and ability to turn, ability to sit much better, crawling, stand with support, and the support starts from waist down and then it becomes less and less. You can see here first a big walker and then a small walker. So the base of support slowly reduces and you will see improvement in functioning. When he went back home, he actually created a mini rehab in his home, continued to work. So at least 6 hours a day of exercise, very important for those with spinal cord injury. The more you work, the more the cells get stimulated and more effect that you see. And so true for other neurological conditions as well. So this is, we're very proud of this individual. He was a soldier who got injured in the line of at the LOC in Kashmir, and he came to us completely bedridden, and with stem cell therapy and rehabilitation, he was able to go back to Mahu in Indore, and he now participates in Paralympics for rifle shooting. He received the Shaurya Chakra for his bravery because of course he was in the Indian Army. Very, very proud of this individual. Cervical spine, neck down paralyzed patients, you can see working very, very hard. The first thing is trunk. They're not even able to turn. So with stem cell therapy and good rehabilitation, ability to turn, ability to sit up, ability for trunk control. Earlier you can see push-ups not possible, needed a lot of support. So trunk control and upper limb strength improved. The problem here is mostly proximal muscles do improve, but the distal muscle improvement takes a lot of time. And in this particular patient, you will be able to see that he is able to use his hands to write. Earlier, his mother had to pick him up, and now he, with minimal support, he's able to shift. So wheelchair independent life, that's what we are looking at. Ability to stand with minimal support with the help of parallel bars, so up to down. So it's not that your fingers are going to move of your legs, it's going to be from your trunk down that the improvements will be seen. So knee locking can be achieved sitting, wearing his own clothes, very much possible. So, you know, we are looking at functional independence, and so that he doesn't even look at this his handwriting, beautiful handwriting. His aim was to be able to sign so that he can go back to work, because he was an electrical engineer in a government setup, and not only sign, he's able to, his handwriting is beautiful. Brain stroke, paralysis and stroke, one of the most common neurological conditions that is being treated. Again, same procedure, and we do see 90% possibility of success, significant improvement almost in 50% of the patients. The improvement in ambulation, so lower limbs improve beautifully, hand function, opening and grasp, and upper limb activity improves, standing, walking, balance, and functional improvement, cognition, understanding. So you can see here PET scan, you can see a whole lot of blue areas, and after the treatment you can see that the dark blue has reduced. The brain is, we are salvaging whatever part of the brain is unconscious or semi-conscious to activate it, to connect it, so that the therapy or physiotherapy or occupational therapy that is being done becomes more effective. Our publications in stroke, example of a young individual, 24 years, with right hemiparesis, right side of the body affected. You can see difficulty in using his fingers, but he improved slowly, steadily. He had a little problem in walking as well. So we worked on the hand, we worked on speech. When right side is affected, that means left brain is affected, that means speech would also be affected. So speech clarity improved, his hand functioning, walking almost near normal, running, and use of hands. So earlier you come, better the results. That's what we find. Cerebral ataxia. Cerebral ataxia is a condition where the small brain atrophies. It could be a genetic condition or it could be because of lack of oxygen. And you can see here the PET scan, the blue areas becoming better and improving. It is a degenerative condition. We see problem increasing. The main aim is to stop the problem from increasing. If patient comes to us earlier, we are able to delay the complications of this condition. This Christy, who came to us when she was 17, 18 years old, now she's 26, sitting balanced. She came to us completely wheelchair bound, with hardly any voice, hardly any speech. Her father is working very hard on her, hard with her. She swims. So her titubations have reduced. Her standing tolerance much better. Ability to do her own ADLs with minimal support. She's a swimmer in Paralympic, and she was able to swim independently, and as she in 2006 received a bronze medal in Special Olympics. And father has given away now the wheelchair so that now she can walk with a walker. Head injury, again, it could be traumatic, it could be non-traumatic. Various processes that happens in head injury similar to any hypoxia. After stem cell, we do find very good improvements. So you can see here the blue area again, the damage becomes green. So activity, you can see the activity before the treatment, 6 months later. One whole part is not there, that cannot come back, but you can see improvement in different parts. So these are publications, and this is an example of an 18-year-old boy who came to us when just out of coma. He fell from a train in Mumbai and was in coma for a long time after the stem cell. Before stem cell, you could see how he was. After stem cell, his whole ambience changed. He was extremely like a very aggressive animal. After the treatment, he calmed down. He's much more receptive. His hand function improved. His cognition improved. His oromotors improved. His motor abilities, the amount of help that he requires became lesser. Very important again and again to do good exercise, good rehabilitation. Able to show numbers, you can see, you can tell, able to show body parts. So, someone who was absolutely, cognitively zero has restarted in his understanding. You can see that before he would hit, we had to actually, tie his hand so that he doesn't hit people while making him stand, and much more calmer. Motor neuron disease. This is Stephen Hawking. Had motor neuron disease. One of my colleagues, Dr. Imangi Sane, is suffering from motor neuron disease, but it's a progressive condition, and sometimes the life is just 2 to 5 years because of respiratory distress. So, rationale of the treatment is basically repair remyelination and improve the neuromuscular junction, reduce the degeneration of the motor neurons. The aim is to improve survival and function. Though the results are about 50%, we do find quality of life can be improved. Complications in general, no major adverse side effects, no irreversible deterioration. Those who have a history of seizures may have 3% chance of having seizure after the treatment, so a proper anti-epileptic cover becomes very important. Some individuals may have something known as a spinal headache, which is transient for maybe for 3-4 days whilst the patient is admitted with us and becomes all right before he or she leaves. A bit of local pain. Other treatments that could help this process of regeneration repair are known as integrated therapies, mainly hyperbaric oxygen therapy and ozone therapy. Hyperbaric oxygen therapy improves oxygenation in tissue because we are now breathing 100% oxygen at higher pressure. So the whole system, the plasma is flooded with oxygen and thereby reducing reducing the oxidative stress. Ozone is again 100% medical oxygen is converted into O2 is converted into O3, and O3 is like a super oxygen and very very effective. There are different ways that ozone can be delivered into our body. It can be intravenous, it can be per rectal, it can be through fumes of breathing through oil ozone. It can be like a sauna. Gut cleansing, this is generally for adults. Gut cleansing, it helps to completely cleanse your gut so that you can cultivate it with good bacteria, so that nutrition and absorption. Cryotherapy and infrared sauna for muscle pain, and intravenous vitamins for adult patients intravenously. This is NeuroGen Pain and Spine Institute. We've treated over 10,000 patients from 70 different countries. This is holistic rehabilitation and regeneration under one roof in a beautiful place in Navi Mumbai near the lake. It has a beautiful lake view, and of late we are seeing flamingos here, beautiful flamingos. Operation theatre and stem cell lab all under one roof. Nothing goes out of the laboratory or out of the operation theatre. So everything very sacred, the cells as well as the process. This is our state-of-art stem cell laboratory. It is GLP and GMP certified, comprehensive rehab under one roof. This therapy for adult as well as for children, occupational therapy, Autism Child Development Center, spinal cord injury walking track, special process, special way of making patient ambulatory, sensory integration, especially children with autism and ID, teaching the child how to do daily activities in a very playful way, speech therapy, special education, art therapy, plus knowledge dissemination via writing books. So we have written books for professionals, for caretakers, for parents in simple ways in multiple languages. This is our core team, Dr. Alok Sharma, the visionary behind the whole concept of regeneration, rehabilitation work together with integrative treatments. Neurosurgeon by profession as well as director of NeuroGen. Myself, one of the deputy directors of NeuroGen. Dr. V.C. Jacob, a very renowned physiotherapist and extremely experienced head of neurorehabilitation. Dr. Prerna Bade, the hands behind the stem cells, the head of Regenerative Lab, as well as Dr. Himangi Sane, head of research, as well as a physician, and all of us, the deputy directors of NeuroGen, accredited with ISO as well as GLP GMP, and also recipient of many awards, international as well as national. Best Institute on Stem Cell, European Medical Association Rose of Paracelsus Award, inspirational company because just for the concept, disability, special work in disability, as well as breast stem cell therapy from our ex-chief minister. Different awards. This is where you can reach us. And each one of you would be given a special coordinator. It's a 7-day treatment, Sunday to Saturday, Sunday arrival with assessments and scans and tests, Tuesday actual procedure, Wednesday to Saturday rehabilitation. And stem cell is safe, it is effective, and safe and effective treatment for various neurological conditions. And what people say and believe that has not occurred in history will not occur at all is to argue disbelief in the dignity of man. So what we think that brain cannot be repaired is contrary to what is possible.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
So this is
There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers. Seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
finish with this very, very inspirational speech by President Obama. Also gives us a pointer as to why the United States of America is much behind what we are doing in India by almost 10 years, because there was a ban on federal funding for embryonic stem cell research in the US since the Bush regime, and it was only in 2008 that that ban was lifted. However, with a lot of promises from President Obama. So this is the thank you for patient hearing, and for I'm looking forward to a lot of interaction and questions. I can already see some of them. Please do reach us at contact@neurogenpsi.com, and I would be happy to do a virtual consultation for each one of you who's participating today, and I'll be taking the questions answered one by one. So Mr. Gaurav Videsia is asking, Madam, when you take the bone marrow from the hip bone, what process do you follow to segregate and multiply them outside the body? So when we take the bone marrow, the process is of segregation but not multiplication. We segregate the mononuclear cells using gradient method separation, which is there in our publications. So the separation of one is known as the mononuclear cells, which contain a mixture of hematopoietic stem cells, mesenchymal stem cells, and very small embryonic-like stem cells. We do not multiply it outside the body. The cells are injected into the spinal fluid. The spinal fluid itself is a very good culture medium for multiplication of cells. So we do not culture them outside, because if you can culture only one type of cell. The mixture or the cocktail works beautifully, so we want to keep that together. How many stem cell quantities injected at one time? We are injecting mononuclear cells, and the minimum is body weight into 10 raised to the power 6. That's the minimum amount of cells that will be injected. So in by and large, 50 to 200 million cells, mononuclear cells would be injected. So a few report that stem cell can cause seizure. Is that correct? And what are the side effects of therapy? I did mention seizures as a possible side effect in those who have a history of seizure or whose EEG is abnormal. And that publication is we have already published that literature. There is a 3 to 6% possibility and that possibility can be reduced to less than 2% by giving proper anti-epileptic cover in those who have a history of seizures. The other side effects, as I mentioned, a possibility of a spinal headache, which is transient, self-limiting for a few, which happens immediately after treatment and remains there for 3 to 4 days. Otherwise, a little bit of pain in the back uh, is all that we expect. How far is the needle inserted in the spine? My wife had a spinal injection for seizure, still hurts her on some days. See, the needle injected would not have caused the back pain. What causes the back pain in a C-section patient is a muscle spasm, because you have not really retrained your muscle, which were for about 9 months a lordosis. Lordosis means your spine had gone ahead because of the pregnancy, and then you had a cut in the front, and because of which you could not do exercise. So the back pain is not because of the needle. Please elaborate how TRS interferes with the stem cell therapy. So any chelating agent, what does chelation do? What does chelation do is a metal or a heavy metal is there in the blood cells. The chelation will try to remove it from that blood cell and may cause toxicity to the cells. And that's why any chelating agent we are a little bit skeptical of, at least around the time of procedure. So reducing the quality of the cells. How do we check whether kid has autism spectrum or not? There are clinical assessment scales. You need to go to a professional, either a developmental pediatrician or a psychologist or occupational therapist, who will do this assessment scales for you, which will clinically assess whether the child is on the spectrum or not. And we could of course do a scan known as a PET scan to get better understanding, but we need clinical assessment. Inakshi, my sister is 30-year-old, cerebral palsy, and son, 21 years old, Asperger's syndrome. Both of them require stem cell therapy. Inakshi, I think we have been in touch with you. I think I've personally spoken to you. We will need to evaluate, and then we can give you a proper idea about how much we can help uh, each of your patients. Deepali Sharma, I'm from Sydney and you would like to come here. Yes, I understand. Currently, Australia is in lockdown and we would be happy to help you once the borders open. Shifali wants to know whether she can walk independently after stem cell, as I am a spinal cord injury patient. Shifali, have we spoken before? I remember speaking to you. It depends on the level of injury, and generally we do find that we are able to help the individual walk independently, but may need some support. You may not need a person's help, but you may need some, depending on the level of injury, the calipers or walker or a walking stick to walk, depends on the level of injury. Have I missed any questions? My son is 5.5 years. Will it be good time to do SCT? Yes. 5.5 is a good age. Earlier the better. Let's not lose this window period. So yes, it is a good age, Depani. Do we use anesthesia while doing stem cell therapy? Depends on the patient. In adult patients, we use local anesthesia. Spinal cord injury, generally, we do not need to give general anesthesia. In children with autism or cerebral palsy, we do need to use intravenous general anesthesia. Yes. You can reach us at contact@neurogenbsi.com. Okay. One more question. Is SCT possible for 46-year-old traumatic brain injury at paralyzed on the right with speech difficulties. Yes, definitely possible. Ashika, please do share with us the reports, and yes, definitely possible. So right side paralyzed on the right. So paralyzed arm is left. Yeah, left pain is affected. So, yeah, definitely possible. We will reach you, and you can let us know. We can set up a virtual consultation. I would be happy to consult you online. Any more questions? If there are any more questions in specific for any patient, please do reach us at contact@neurogenvsi.com, and we would definitely get back to you. So I hope all of you are being safe. Please take care of yourself. Do vaccinate yourself as far as possible, as early as possible. And even if you're vaccinated yourself, please know that you have to wear masks and take care of yourself. Do follow social distancing. It's a difficult time for all of us, but survival is important. And take care of your health. Okay? And I will see you again in the next webinar. Have a good day. Have a great weekend.